Let's take a look at how this $3,000 penalty works. So again, just like the other penalty, if no full-time employees receive a credit, there's no penalty assessed. If one or more full-timers receive a credit, then you multiply the number of full-time employees by 3,000, by the number of full-time employees who receive a credit by $3,000. So assuming 10 full-time employees receive the credit, the potential annual penalty would be $30,000. And there is a stopgap here that essentially limits the penalties to, at most, the $2,000 penalty. And so, in other words, what they're saying here is that in no event will you pay a greater penalty because you offered unaffordable coverage than you would have paid had you offered no coverage at all. So it's the lesser of the $2,000 per employee penalty versus the $3,000 per subsidy receiving employee penalty. We have recently received some additional guidance from the IRS in terms of how to determine who is a full-time employee for purposes of the employer mandate. Most employers are not going to need to worry about whether employees are full-time or not because it's pretty clear to them. But other employers that have a lot of variable hour employees that obviously work various hours during the year, they may need to avail themselves of this safe harbor to ensure that they know whether they should offer coverage to their employees so they don't get hit with a penalty. And the way this works is by using a look-back and stability period. And this is a safe harbor, so employers are permitted but not required to do this. And so the employer, in its discretion, picks a measurement period that's between 3 and 12 months. And it looks back at all its ongoing employees during that 3 to 12-month period, and it asks whether these employees, or it calculates whether these employees average at least 30 hours per week. If the employees average 30 hours a week during the measurement period, then they're going to be treated as full-time during the subsequent stability period, regardless of the hours worked, as long as they stay employed. I want to talk for a minute about variable employees, and the guidance essentially gives us two types of employees, a full-time employee or a variable hour employee. And if on an employee's start date, it can't be determined whether he is expected to work on average at least 30 hours a week, then he's treated as a variable employee, and the employer uses an initial measurement period to determine whether he's going to be treated as a full-time or part-time employee. And you can essentially use an initial measurement period that's up to 12 months for purposes of determining whether your part-timers are full-time. And there's an additional administrative period that an employer can use to take some time to perform the administrative tasks of giving employees the enrollment materials, enrolling them in the plan, giving the SBC, and things like that. And so the employer has this administrative period that it can use, and during that time, no penalty will apply if the employee doesn't receive coverage. This also coordinates with the 90-day limit on waiting periods, and essentially says that with respect to a full-time employee, an employer is not going to be subject to a penalty for the first 3 months following an employee's date of hire, which obviously is meant to coordinate with the permitted 90-day limit on waiting periods. That takes us through my prepared slides. I wanted to make sure I left a few minutes at the end for questions, and so I'm happy to take them now if you'd like to either type them in or ask them live. Either is fine with me.
Stacy, we did have another one that was typed in a little earlier on a previous slide. It was, is there a minimum number of employees required for an employer to have to participate in HRA in general? There's no minimum participation, is there?
For an HRA?
Correct.
No. I think they're talking about a health reimbursement arrangement. There's also those health risk assessments, but no, there's no minimum number of employees required, although because an HRA, a health reimbursement arrangement, is a self-funded plan, the non-discrimination rules apply. So the smaller the company, you just want to make sure that you're giving it on or offering it on a non-discriminatory basis. For example, if you offer it only to your management employees, then it's going to be discriminatory and they're going to have income inclusion. Any other questions?
Yes, another one came in. Is there a way for us, let's see, is there a way for us to obtain a copy of the presentation slides? Yes, we will send a copy of the presentation, the PowerPoint version, as well as a recording of this session to all the participants. And I don't see any other typed in. I'm looking to see if anyone's raised their hand to ask a verbal question. I don't see one at this time. Here, another one just came in. This one is someone who signed in a few minutes late. They have a group of 22 employees. Are we subject to these rules? I might want to, well, I don't have a way to unmute just that one person. Let me see if I can.
Well, I can give them a general answer. In large part, all of these insurance mandates and market reforms apply to all employers, whether they're small or large. There are a few notable exceptions, one of which is the W-2 reporting. The other one is the employer mandate. And we really try to identify when there is an exception for a small employer in the slides. So if you don't see an exception in the slide, then one doesn't exist. So for example, one of the questioners earlier asked if there was a small employer exception to the SBC requirements, and the answer is no, that the regulators did not provide a small employer exception for that particular requirement.
Jack, if you have anything to add or any questions on your end, I'll go ahead and turn it back over to you.
All right, well, very good. Thanks so much, Stacy, for this informative presentation. And Amber, we appreciate the partnership with you and Assurant as well. So thank you for assisting us with this. And I'll just add that if any of our participants have any further questions, we encourage them to contact their account manager at BIS. Or if you're not a current client, you may just contact us at 770-645-6908 or at BIS@BISbenefits.com. So again, thanks for joining us, and we'll see you next time.
All right, thanks so much, everyone.
Thanks, Jack and Amber, and have a great day, everybody.